You are now listening to Regard Podcast with Tessa Markle
and Carolina Alvarez.
Femme.
Welcome back, Femme Fam, to our official beginning of season 6. Woo! I know it doesn't make a big difference to you guys as listeners because, we're doing it weekly, so there's no stopping and starting for seasons. But for us, this means we've officially been going for 5 full seasons. That's over 50 episodes. So thank you for all of your support because it absolutely means the world to us. And we couldn't do this without you guys, especially our new patrons. And if you don't know what that means, check out our post about Patreon. Just visit patreon.com/femregard and you can help us by donating. But all of that said, I'm more excited to get into our first guest this season. We have here Dr. Nidhi Gupta. And Carolina, how did we first find her? Do you remember?
Yes, we got a DM from the documentary that she's working on, their Instagram account for Start, Stop, Repeat. And I think we've also just been connected with Rain Dance UK, which you guys should check out. They have amazing resources and amazing community to connect with. So I think that just all kind of brought us together because we've both been on the Rain Dance lives. And so we got a message, and I just thought it was the perfect documentary to highlight and hear about. And it's because it's a documentary on COVID-19. And I really like that they're focusing, and we'll have Nidhi speak more to it in a minute, but I love that it's focusing on the positive outcomes of the pandemic and messages such as wanting to see the real change out of the world and what we can learn from it. And then on top of that, the director, producer, Ms. Nidhi Gupta, she's a doctor working the front lines herself on the National Health Service in London. So this is someone who's been at the front lines, at the head of it, and knows really what's going on. So I was like, well, of course we have to have her on and hear about this.
I like how you said, I know what I'm talking about, as if I understand any of it. I'm not sure that's good. Just as saying, knowing and understanding are two very different aspects.
But you're there, you're seeing the causes and effects. And then also on top of it, you are a COVID survivor. So you're someone who's went through it, been through it, and came out of it alive. And thank God, we're glad to have you here, especially.
Thank you. Well, thank you so much for having me on. It's an absolute pleasure to be on. And I'm glad that you're both safe as well.
Oh, yes, we are. Thank God. We count our blessings. So let's hear, I'm just curious right off the bat, what came first, the doctor or the filmmaker?
Oh, doctor. Doctor definitely came first. It never really occurred to me at school or at university to be a filmmaker as a career. But looking back, I was writing rubbish, of course, at the age of 11, 12. And kind of as a 15-year-old, while all my class peers were into New Kids on the Block, which gives you an indication of my age. I was really into films, absolutely, totally into film. And, but I did my undergraduate degree in biochemistry and then went to medical school. But within about 2-3 months of me graduating medical school, I was doing my first writing course, kind of my first weekend writing course. And I say I in retrospect, I was a hobbyist for about 10 years, kind of just at the weekends.
Working
very
on
much
it.
focusing on my medical career, but kind of, just hanging out, being in a kind of like a runner on short film sets and stuff. And then around 2012, 2013, so I spent a year living and working in Papua New Guinea, which is a whole other thing. But I was about 3 years away from finishing my training as a doctor. So for US listeners, I'm a attending, but we take about 8 to 10 years to become an attending in the UK. And I know in the US, I think it's about 4 or 5 years, I think it is, from graduation.
Sounds right,
yeah. So we take about twice as long because we do a lot more general other things as well as our specialty. So I was about 3 years away from becoming an attending, a consultant is called here. And I basically had to make a decision. I was also trying to maybe get a PhD because I was just bored in my job basically. And it was like, I need to decide. So I decided, no, I'm going to be a filmmaker. And my plan was initially to actually leave medicine after I finished my training, and be a filmmaker full time. But then kind of paying bills and the need to earn money,
Plus
but
all
also
that time you
just
already put in. I mean,
that tiny thing, putting food on my table, putting a roof over my head. Who needs that? So kind of the need for that kind of kept me in. But then I found
a true
filmmaker,
y'all, a true filmmaker.
Well, I found a hospital about 2.5 years ago that actually supported my filmmaking, in that because I started out in short films, writing short films and producing them. I then started an online medical education business where we have filmed nearly 40 hours of online content for postgraduate doctors around the world. So I've been working on that, and we're building up for the first feature narrative for the last couple of years. And but up until about 2.5 years ago, I never talked about my film work in my NHS work at all. And that's not to do with the NHS as a whole organisation. It was just the people around me that I was working with. But the hospital in South East London that I'm in now, they were just like, no, you have skills that we don't have. So, bring them along, because you add to us. And, that is a real positive, also quite unusual within kind of the medical profession to recognize that outside of medicine, there are skills that can be brought in. So I'm now, for the last few years, it's been, it's part-time for both. So I do the medicine 2 days a week and the filmmaking 3 to 4 days a week. Except COVID, when the film world collapsed and I went back to the wards full time. I basically said, wherever you need me, just, send me wherever you need me. And my specialty is, I think the equivalent in the US would be internal medicine.
Okay.
So acute medicine, which is like the first 72 hours of a patient's admission. And basically when the pandemic hit, because London is the hotspot of the UK, we've had the highest number of cases and everything. So it was just basically COVID. So, and it's nice now in the last kind of few weeks, being able to we're trying to return back to some sort of pre-COVID normality from the point of view of our workload. I haven't got any scientific basis for this to actually give you evidence, but I just think for London, it's just torn through us in terms of, I just think for us, it's torn through us completely. Basically there's no one in my hospital that I work in that I know that hasn't had it. Basically.
Wow. So scary. Also, a note to listeners, because you'll be hearing this a little bit after we record it. We are recording today on July 28th, just to give you a little reference point for when you're listening to this.
You're welcome to look at our numbers, but the numbers coming out of the US are scaring us. We look at them and we went, come on, we made all the mistakes. Why are you following our mistakes?
Americans, they like to not listen to anyone and just think they're always right. So,
are
you sure they're not British? Because we're exactly the same. We're no different.
What is exactly the National Health Service in London? Because I tried to look it up too. Is it?
So the National Health Service in the UK, it is unique. It's the 5th largest employer in the world.
Wow.
Of a single organisation. And it's so basically in the UK, the National Health Service is a free at the point of service healthcare, 100% coverage in the UK.
Oh, wow.
It's paid out of taxes. So as an individual, I pay my taxes. I can use the healthcare as much as I need. I do not get charged for it as an individual based upon how much I'm using it. It's done nationally through taxes.
That's amazing.
Wow.
So unlike kind of private healthcare where, I know kind of from my reading in the US where, a lot of people are kind of bankrupted and, their premiums and the HMOs and stuff. We do have private healthcare. That is an option, but it's a side option if you want to get some things a bit faster, but the NHS is no, everyone gets 100% national health coverage for whatever your needs are.
Okay.
That's awesome. That's something a lot of us are aspiring to have in this country, but a lot of other people are very against.
What's your day-to-day working there? An average day?
In terms of my day to day, so because I do 2 days a week, I'm actually going in tomorrow. So I work in admission avoidance. So basically, the department I work in is about trying to prevent admissions to hospital. And so we do next day diagnostics like CT scans and investigations. And we do kind of daily treatments, things like intravenous antibiotics, but you go home. So it's a case of, well, if I'm going to give you one dose of antibiotic in 24 hours, why do you need to sit in hospital and wait for the next 24 hours?
Right.
You can go home, come back in the next day to us, and then we'll give you another dose. And so the whole idea is that we give the equivalent of inpatient treatment, but on an outpatient basis. The idea being that the less people in hospital, less likelihood of complications, side effects, getting out of infections. Plus also, we are a finite system. There is no, finite resources. There's nothing with infinite resources. So it's about how we manage those constrained resources, that maximizes patient care.
So I really want to get into start, stop, repeat. How did you decide I need to share this with people. I need to really, make this project and take time away from everything else you're doing. I'm sure this is the busiest you've probably ever been.
Well, actually, my Twitter handle is Busy Doctor. So it is actually, I am the Busy Doctor. Kind of, when you say never, and then I was saying, I never want to be a director. I'm a producer, I'm a writer, and I'm going to focus on that. And so what happened when COVID hit, the film world collapsed, all production shut down. And as I said, I went back to the COVID wards. And because of where we are in London, we got it weeks before the rest of the UK. And so we knew in February, early March, okay, Black and Asians are getting it worse. They're dying more. All those things, which it's taken months for the kind of, for the powers that be to go, oh yes, we've looked at the data and Black and Asians get it worse. Yeah, we know that. I could have told you that at the end of February. We could have all told you that. So we were seeing it, and just the devastation, because in London we have high immigrant populations, people who are from low socioeconomic backgrounds, who don't have as good a health. They don't live in nice leafy suburban big houses with gardens. They live in blocks of small apartments and stuff, crammed in. And, trying to get on the underground, the metro, everyone crammed in like sardines and stuff, it just spread like wildfire. And so I got COVID and I ended up in hospital myself for a week. And I mean, it's been about 3 months since I came out of hospital, and I'm still recovering. I don't say I'm recovered. I say I'm recovering.
So it was around March that you got it?
Yeah, I got it at the end of March to April is when I got it. Because March and April was when I was working in the hospital. And did they say I was there every day, basically? It was just being in my face, bam, in my face every day. And there's only so much the body can take. I mean, I hike mountains. I've literally climbed mountains, and I hike 100 miles in a week. It's not like I'm an unhealthy person. I just think a combination of my genetics and just the fact that I just got so exposed every day for weeks on end just overwhelmed my system. And kind of as I came out and literally sitting on my sofa, not able to move, I was struggling to walk across the room. And I was just reading about previous pandemics, because one of my specialist interest areas in my medical work is tropical and infectious diseases. And we knew that, there's been kind of there was, everyone talked about when is the next pandemic. It's going to happen, not if, but when, not if, but when. But I realized I'd never actually learned about previous pandemics. I've never actually attended a lecture or read a book about previous pandemics. And I was reading about it, and just the parallels to today just made me so angry, because the last great pandemic was 1918 at the end of the First World War, And, there were debates about face masks. It was a German-Austrian bioweapon. They tried to do social distancing. There wasn't any treatment. There wasn't any vaccine. And I'm just like, I'm sorry, am I reading about 100 years ago? Am I reading about today? Nothing has changed. And you read all the papers, all the academic papers, the fact that So in this country, in the UK, 3 years ago, they did a tabletop exercise where they worked out, okay, how would we respond to a pandemic? And basically the result of that exercise was, here, we aren't prepared. Was anything done about it? About the fact that we weren't prepared? And they said, yeah, we ain't prepared. And we apparently in the UK used to have a reputation of being one of the most prepared countries in the world for pandemics. Poof, out the window. But also the positive sides of what happened. So things like in the Spanish flu, it was a catalyst because people saw the inequalities. It highlighted inequalities in society. The way, because that, for example, Gandhi in India, he was victimized because he sat in a third-class train carriage because of the Spanish flu laws of the British Empire, and that solidified his fight against the British to get them out of India. It led to uprisings against the Japanese Empire in Korea. The 1st of March 1919 uprisings. In Egypt, women marched against the British Empire because of the Spanish flu. In the UK, 2 female gay doctors who before the First World War weren't even allowed to work in hospitals. Like, they weren't allowed to work in hospitals. Louisa Garrett Anderson and her partner Flora Murray. And when the Spanish flu came, they weren't allowed to close their clinic because they were so essential. So they went from, we don't need you, to you can't leave. There was a doctor, Kathy Lynn in Ireland, who was a Sinn Féin activist, who was released from prison to work on Spanish flu, to work with patients with Spanish flu. And she set up the first children's hospital in Ireland. And she was a freedom activist. So many positive things came out because it really highlighted the issues of the day, that people weren't kind of being, from like at the time of the First World War, they weren't distracted. They're like actually focused on things. There's from Louisiana, there was a quote from a survivor of the Spanish flu in 1974 from an African-American gentleman. And I'm going to misquote it because I haven't got it in front of me, but he basically said, if white and black, or he called it colored folk, worked together the way they did in the Spanish flu, things would be better. And he said that in 1974, 10 years after the Civil Rights Act. That you can't, there are so many parallels. People aren't being distracted from the everyday. And if, we can learn from past pandemics, if we can learn, the positive aspects, then hopefully it's not just a flash in the pan. It's not just, we'll think about it, we'll do some token gestures. It's about what can we learn from past pandemics that means we can have some sort of positive future. I mean, things like social distancing and masks, and, they came out of plagues. They came out of the plague pandemic. We are literally using the same method to reduce the spread of a disease that they've been using for hundreds of years. And the thing is that what's interesting is because the Spanish flu, by the way, do you know why it's called Spanish flu?
No,
I did some little snooping and I want to talk about that. The Spanish flu epidemic of 1918 didn't originate from Spain, but was thought so because they were the only country who was free to release the information and press about it. And
because they were neutral, they were neutral in World War I, so they were the only country with a free press.
So how do you feel about like how press is involved today? Because again, you're a doctor, you're on the front lines, and is that also why you want to create this documentary? I want to bring it back to that.
Yeah, absolutely. I mean, I mentioned it earlier, which was, there were theories that, the Spanish flu was a bioweapon made by the German Austrian Empire. How different.
Oh, we love our conspiracies,
exactly.
Don't we? Everyone does.
People were giving vaccines to what? We don't know, because it wasn't to influenza. There wasn't a vaccine that existed to influenza at that point. And, it's like, well, that didn't exist. So you're just giving rubbish basically to people. Drugs were, pharmacies had to control the number of drugs that were being bought, because everyone was just buying up every drug, trying to come up with something that they thought that would, cure them of this disease. Where have we heard that before? And, They also, a lot of health authorities didn't reveal the number of deaths because they didn't want to worry the population.
Interesting.
Yeah,
Interesting.
where have we heard this before? It's, and the only difference I would say primarily is the internet. It's the only real difference between then and now.
And Twitter.
Yeah, in terms of, the way we disseminate information and we get it, is whereas back 100 years ago, it was very much controlled by a small cabal of, newspapers who were in bed with the government. Where have we heard that before? Now that is still true in terms of mainstream media, but in terms of there are all these other outlets that you can consume information and find out what's happening in Brazil, in India, in Australia, in South Africa. You don't need to, wait for, whatever kind of, the government and the mainstream media decide you need to know. The difficulty with that is, of course, at the moment, we've got these bubbles. People live in their own online bubbles and, they share conspiracy theories and anti-vaxxers, all that kind of business. And the amount of rubbish I've seen, just, somebody, friends who are not medical going, is this true? I'm like, what, the drinking hot water will stop you getting COVID? No, no. What? What? And just all these ridiculous, so it's like everything is a double-edged sword. You get more information, but, in this era of fake news, we don't know how much of it is actually true information. In the UK, we've opened up mostly now. And I get, in terms of the longer term issues, that poverty kills. So people have not been able to earn money, have not been able to go to work. They've lost their jobs, and poverty does kill. We've had higher rates of domestic abuse and, child abuse and neglect, and, the suicide rate has gone up. And so the balance of, you're trying to say, okay, yeah, we're trying to save people now, but are we just saving those deaths for later? There's also, with our healthcare service, the fact that because it was such an effective message of stay home, protect the NHS, save lives, that people with non-COVID symptoms sat at home for longer than they should have done and didn't come into hospital with their heart attacks and their strokes. And we've got this big kind of mountain that we are starting to have to try and claw back from, is all these people who have their longer term, these other conditions, who haven't sought medical attention early enough. And so they're going to have a higher rate of mortality and morbidity and complications from the fact that they didn't get treatment early enough. And it's a case of our system, our society is not robust enough to deal with it. We haven't created a society, an infrastructure that means that when these things hit, we can withstand them and it not completely collapse our country. But whereas you look at places like New Zealand, like South Korea, like Taiwan, where they've smashed the virus, they've hardly had any cases, but also their economies have not been destroyed. The estimated global, this was from 4 or 5 years ago, a paper, the estimated global kind of economic fallout from any pandemic was estimated at $490 billion. Why was that not listened to? I wish it was conspiracy, but no, it's the conspiracy of incompetence. Pandemics are inevitable. This wasn't the first, it won't be the last. But it's up to us how we go from here, in that we can choose to forget about it, try and return back to the old normal or whatever the new normal is. But, the old normal wasn't that great for a lot of people. Like there was a lot of people for whom normal wasn't a great time. It wasn't like, a land of milk and honey where, money trees and stuff, it was actually a pretty horrible place. And it's a case of, well, can we use this as a catalyst? Can we use this to actually create a more sustainable, better future, so that when this happens again, and it will happen again, maybe not in my lifetime, but it will happen again at some point, can we have a more resilient society and infrastructure? But also just, if human beings, if your population are healthy, they are going to be better, they are going to be more productive, they're going to be happier. You are going to have a better country by having a healthier population. Just that concept that people have to suffer for improvement. That's not true. But we are suffering. So how can we find a positive future? And I mean, I don't know what the answer is in terms of how we find that positive future, of what those positives will be. You know, I don't pretend to have those answers, but that's why I'm making a documentary saying, well, what can we learn from the past to find those positive futures? I mean, there's a classic quote from 1905 from the philosopher George Santayana, which is, those who do not learn from history are doomed to repeat it. And hence the name start, stop, repeat, again and again and again. You know, we just keep going around in circles because we're not learning from our past. So by highlighting the fact that this isn't the first time it's happened, it won't be the last time, what can we learn from our past and our present for our future? And that's what I'm hoping to kind of talk about. But recognizing I don't have all the answers. I don't pretend that I know what the answer is.
Yeah, I think that's just really important, is for people to understand and realize, like you said, you know, this has happened before, it's going to happen again. And all of these issues surrounding it have happened before, they're going to happen again, you know, and it's nothing new. And I think another thing that's really tough for people to grasp is like, they're seeing science unfold, you know? So yes, we're getting lots of different answers and hypotheses and all of these things, but that's because that's how research and science develops, you know, and most of the time we just get the end result, but like we're in the middle of it. So, you know.
Well, it's not even in the middle of it. I mean, this disease is less than 12 months old. And I get so annoyed with, we're following the science. There's no the science. It doesn't exist. The science doesn't exist. If you think about tuberculosis, we haven't had a new tuberculosis drug in 40, 50 years. You think about HIV/AIDS, it's a remarkable achievement, but to have HIV go from a death sentence to better prognosis than diabetes in 30 years, that's insane. And for medical science, that is just the most rapid progression you could ever imagine. So the idea that in less than 12 months, we're going to have a vaccine, we're going to have a cure, we're going to solve it all. We don't know what it is yet. Like and also so much of the research that is being published is just guff. It is just absolute guff, because right now you want to get an academic paper published, just put COVID in it. That's all you need to do. Just put the word COVID in it and it gets published, and the newspapers pick it up as if it's hard science, as if it's fact. Like, no, this is a debate. This is a conversation.
What would you say are then good resources for people to follow and be mindful of, and to then have like continue that conversation without like judging it, like the hardcore facts and stuff?
So the WHO website is an amazing resource. They have daily fact sheets, which are for the layperson and not just for doctors and nurses, healthcare workers. They're for anyone. The World Health Organization has amazing fact sheets that give daily updates, so of exactly how many people have been reported to them. I know WHO is a very contentious organization, but in terms of, you know, putting aside the politics, they are a good resource of factual information that you can, you know, take to the bank. You know, they will not publish false information, you know. So whatever they're getting and they're giving to you, you can, you know, that is factual. And I've actually worked at the World Health Organization. I did a world internship there a while, you know, back in the day. So, you know, I know how they work. So, you know, whatever their issues, good or bad, but they are really good resources. And there's a lot of academic researchers on Twitter, on Instagram, on you know, who are publishing, who are giving information. They're giving a lot of information. And, you know, it doesn't take a few clicks to just, you know, if you're looking at somebody says, I'm a researcher, just go look at their academic papers. And also the CDC in the US. The CDC is a great organization, and they provide, they do so much information, infographics, and resources that are used around the world.
It's amazing. Thank you.
Excellent. Yeah, no, thank you for sharing that.
And I want our listeners too to be able to, I mean, obviously watch your film, but follow the journey of the film and your journey as a filmmaker, as a doctor. So if you want to share how our listeners can find you and find that your specific film and all of that. Yeah.
So, actually, as of today, 28th of July, our teaser trailer dropped, which we've been working on for the last few weeks.
Oh
so
my
that
gosh,
dropped
yay.
today. So if you go to greenlit.fund, because we're doing a crowdfunding campaign, so green as in the color green, greenlit.fund, and you just look for Start, Stop, Repeat. On there is our teaser trailer. And yeah, if anyone is able to donate, I know everyone's struggling at the moment, so kind of we're very careful about what we're asking people, but we're saying if you can donate the equivalent of a coffee, basically, essentially. But also I'm out on Twitter at Busy Doctor, and we are on Instagram at Start, Stop, Repeat. So yeah, if you go to any of them, you'll find all the links to everywhere else. So yes, I post. I try to keep my anger just a little bit touched, because otherwise I'll just be like all the time. So I do try it.
I mean, so do I, and I don't have a documentary out about this. So.
Yeah. Well, I mean, I've got so many books I'm reading at the moment. Like my shelf is just full now of books about pandemics. It's like, you know, everyone's talking about, well, what are you doing to relax? I'm like, reading books about pandemics. But that's a very relaxing thing for me to be doing. It's like, but this is my research. I need to do this research.
Absolutely. No, absolutely.
Well, thank you so much, Nidhi, for coming on today, and like so much knowledge today. That was so helpful. I mean, like, honestly, just for us to know right now today, but for our listeners in 2 weeks, I believe is when this is going to be released. Just, you know, because I mean, not a lot's going to change in 2 weeks. I think we can all agree on that. But it's so helpful to hear it from someone who actually knows what's going on, who, you know, first of all, is educated in that world, you know, but also has actually been there. You've had it. You've been working on the front lines with it, doing this documentary on it. Like, you're the person to talk to about this, you know.
Thank you.
Thank you so much.
Thanks for listening to Femme Regard Podcast. If you like what you hear, tune in next time for more tips on the filmmaking business and insightful conversations with industry professionals over tea. We can only grow with your support, so please subscribe, share, rate, and give us a 5-star review on Apple Podcast. If you leave us a great comment, we might give you a shout out on the show. For more on us, check us out at femregard.com.